30 top U.S. health officials are urging Americans to roll up their sleeves, not only for the COVID shot, but also to protect against the flu. But there is some confusion over the timing. Some medical experts have suggested spacing the two shots out. But this week, Dr. Anthony Fauci said it is so crucial that doing them at the same time is okay.
If that means going in and getting the flu shot in one arm, the COVID shot in the other, that's perfectly fine. Whatever it takes to get both of them, go ahead and do it.
Joining me now to talk more about this, Dr. Scott Roberts, an infectious disease specialist at Yale New Haven Hospital. Dr. Roberts, thank you so much for being with us.
Thanks, Erin. Thanks for having me.
So it's that time of year, flu shot time, and a lot of us are talking about the fact that we may need a booster shot. We may also need to get the flu shot. When do we get it? Where do we go? So many questions, and there's been some mixed messaging. So first off, is it safe, like Dr. Fauci said, to get the COVID vaccine and the flu shot around the same time, or should people really try and space them out?
Yes, it is definitely safe to get both vaccines at the same time. Some practices space out the vaccines by 2 weeks, and this is really just a monitor for side effects. If somebody has an allergic reaction after receiving both vaccines, sometimes it's hard to know which vaccine caused the reaction. We now know that these events are very rare, and there is no safety concern or any other concern where one vaccine works less well by getting both at the same time. So we do say that it is okay to get both.
If someone does want to spread out the shots, is there a priority order? Should someone get the booster shot or the flu shot first?
You know, I wouldn't be too concerned about getting them at the same time. But if somebody did want to choose, I would get the COVID vaccine first. And this is because COVID right now is really circulating in much higher amounts in the community, while we still really haven't seen much of flu around this region or in the nation.
If people do have the ability to spread the two shots out, is there a certain amount of time that's recommended, say 1 week versus 2 weeks versus a month?
The only real recommendation is just 2 weeks. So if there is some sort of reaction to one vaccine, that we have the time to see and make sure that it is that one vaccine and not the other one. But if somebody can only come in for one appointment, then we would recommend at that time to do both vaccines at that one appointment.
All right, so we are clear on that. Thank you for that information. I think that probably helped a lot of folks at home, including us here in the studio. Also want to ask you about the COVID booster shot. People who got the 2-dose shots, either Pfizer or Moderna, most didn't experience that many symptoms from the first shot. The second shot, not so much the same. A lot of people experiencing symptoms. Do you expect that to be the same for the booster shot? What are you seeing?
You know, that's a great question. And a report did come out today. And what we've seen so far is that most people who are receiving the booster shot are experiencing very similar symptoms to what they had after the second shot. Right now, there's no evidence that anybody getting a booster shot will have any worse side effects. And I think it's important to note that these side effects, most commonly they're arm pain, muscle aches, fatigue. These do go away after a few days and are relatively benign.
And again, just means that your immune system is thriving and working, right?
Exactly.
All right, Dr. Scott Roberts, thank you so much. You're a wealth of information. We really, really appreciate it.
Thanks, Erin. Take care.
You too.